And we can get a taste of things on the front line now. We can speak to Will Broughton, a paramedic and spokesperson for the College of Paramedics. Good evening.
Hello.
So how bad is it when, let's focus on ambulances and those delays in getting an ambulance when you need it. How bad is it at the moment?
It's terrible at the moment. Patients across the country are waiting far too long for emergency ambulances to arrive, and we just can't respond to people quickly enough or in the correct amount of time. So at the moment, the situation is pretty terrible.
And so what's going on? Why can't the ambulances get there in time, in your view?
There's a number of factors. There's increased demand on ambulance services, so there's lots of people calling 999. We've also got delays at hospital where there aren't spaces to offload patients into the emergency department. So ambulances are then queuing at hospital and they're unable to respond to patients in the community. And this is also having a profound effect on staff. We've got record levels of staff that are going off sick across frontline and in our emergency operations centres. So we've got staff shortages, queues at hospital and increased demand. So just the number of people calling 999 is very high.
So all those three main factors coming together, meaning these big delays, as if you're at home when you call 999 and you're having these huge wait times. How scary is that? How dangerous is that? What are the kind of risks that patients are facing because of it?
It's incredibly dangerous, and we know that on a daily basis patients are coming to harm across the system because of these delays. And ambulance services and all of those people who work within them are doing everything they can to respond to patients as quickly as possible. But at the moment, we just aren't getting to people as quickly as we would like to in some cases. And so it is taking too long.
And so it is taking too long. How do you fix it? What would you like to see change to try and speed up those times?
I think we need to see real acknowledgement from government as to the seriousness of the problem. There was a very poorly attended debate earlier in the week with an urgent question about ambulance delays, and there were very few MPs in the House that took any notice of this. And things were announced that were there to fix the problem, but they're not ready yet. Things such as the auxiliary ambulance service that was announced, it's not ready, it's not there. So there are lots of long-term or longer-term solutions being presented. But we need urgent action now, and we need people to take this situation very seriously, because patients are calling 999 and ambulances just aren't available or aren't responding to people quickly enough.
So is that, you said you need urgent action now, it's all well and good having those long-term plans. Is there anything that can be done straight away to try and fix it?
There is no easy fix. We need to try and address the system problems with demand on ambulance services and on emergency departments, making sure that there's space for patients to go into when ambulances arrive at the emergency department. So that's looking at things like social care and making sure patients can be discharged. We do need to concentrate on making sure there's a workforce to respond to these patients. The moral injury that's being experienced across frontline services because we're not getting to people in time, because people are coming to harm before we arrive, that's having a really significant effect on people that are doing these jobs and trying their best to get to everybody as quickly as they can. So there's addressing the workforce shortages. We've desperately got to continue training paramedics, ambulance staff and others that work and respond for the ambulance service to make sure that there's enough people there. Yeah. We also need to see more resources put into the system to make sure ambulances can offload and then get to those patients who are in the community.
Plenty of challenges. Will Broughton, thank you very much for coming on and explaining them to us. Thank you.